My name is Adrienne Green, and I will be doing my final presentation on the evolution of HIV and AIDS. The origins of HIV and AIDS have been in question since the identification of the disease and the social awareness of the disease in the 1980s. After finding out about the disease, scientists did a sort of origin mapping to figure out the ancestry of HIV and AIDS. It was traced back and found out that HIV-1 came from a strand of virus called SIV, which is found in the Democratic Republic of Congo and chimpanzees. Chimpanzees transmitted the disease to humans by humans consuming the meat of a chimpanzee infected with SIV. In humans that their immune system cannot fight off SIV, it would turn into HIV. You can not only contract SIV, which turns into HIV through consuming meat, but also if you had a cut or open wound on your body, if the blood of a chimpanzee entered your bloodstream that was infected with SIV, it would infect you with HIV. The first blood test was then done in 1959. Then in the 1960s, there was evidence the disease had begun to spread. And by the 1970s, the disease made its way from Africa to the United States. Before the 1980s, the transmission of the human autoimmune deficiency virus was not accompanied by any noticeable signs. And then in 1985, the first 5 cases were recognized, and unfortunately, a stigma started in America on the virus because of lack of scientific knowledge on the disease. And in 1981, the first 5 cases were found in 5 gay men. Doctors were not sure where it came from, but all the public saw was that it was in the gay community. The influx of patients with the mysterious immune disorder began to arrive. And then in 1981, 270 cases were reported, and of those cases, 221 people had passed away. Researchers then labeled the disease in 1982 as GRID, which stands for Gay Related Autoimmune Deficiency. In 1982, the first evidence that AIDS is not only transmitted through sexual intercourse was found. A 20-month-old infant who had multiple blood transfusions at birth developed cellular autoimmune deficiency, and this was because one of the donors had passed away from AIDS. Then in 1985, the US FDA licensed its first commercial blood test. And in 1986, AZT was the first drug approved. In the 1990s, it was finally approved for pediatric use, which was a stride in scientific discovery because the next generation would be able to test whether or not they had AIDS and HIV and could prevent the spread. And in 1992, the FDA allowed a 10-minute test kit for health professionals to detect the presence of HIV-1. And then in 1993, there were 3 new conditions discovered of AIDS. In 1999, human vaccine trials had finally begun. And it was a stride that it begun in Thailand, which was a developing country. In the 2000s and 2010s, we see major medical and scientific discoveries in the disease. In 2000, an effort to get medication to developing countries began. The World Health Organization announced a joint effort with 5 major pharmaceutical manufacturers to negotiate reduced prices for HIV and AIDS drugs in developing countries. And in 2002, the FDA approved the first rapid HIV diagnostic test kit for the use in the United States that would produce a 99.6% accuracy within 20 minutes. A couple years later, in 2004, the FDA approved another diagnostic testing kit that can take fluid samples and test HIV within 20 minutes as well. And then a milestone happened for scientists, researchers, and doctors in 2009 when the FDA approved the 100th antiviral drug. In 2010, HIV drugs reduced the risk of HIV negative men who were having intercourse with HIV positive men by 44%. And we see a lot of the presidents put in place in their proposals that are putting an effort to help people with HIV and AIDS and further research. And in 2021, the HIV National Plan for the US had a roadmap to hopefully end the epidemic from 2021 to 2025. They have a 10-year goal to reduce new HIV infections by 90% by 2030. There are 4 goals and objectives and strategies being placed. In conclusion, from 1980 to the present day, we have made major scientific discoveries and have found and squashed the stereotype that HIV is only transmitted through the gay community. It can be transmitted via sexual intercourse or sharing needles, or it can be transmitted by blood transfusions. But thankfully, the medical world has preventions put in place to make sure that patients who are receiving blood donations, the blood is clean and without any viral or any type of disease within the blood. And also, doctors have to wear protective equipment to protect themselves and also the patients to make sure that they do not pass any diseases along. Through science, HIV and AIDS is no longer a death sentence and has made major strides.